What if I told you that 3 million seniors are about to get $6,000 checks from the Social Security Administration? And are you aware that half of the services that you could call the Social Security for have now been moved online? And for most of them, you have to visit a Social Security office to perform those services. You cannot call the Social Security Administration for services anymore. And did you know that if you owe the Social Security Administration for overpayment, they are going to take your entire Social Security check until you have paid the money you owe before they will resume your benefits? These are part of the 10 changes that have already happened to Social Security benefits this year, some of them under President Trump, that I want to talk to you about today. So let's dig in. And also, stay till the end of this video because I have news about Medicare, how you can save $1,100 with an advocate that is going to stand with you against the insurance companies to make sure that you get the right benefit that you deserve. My name is Kwame Kwade. I am a personal finance expert and an entrepreneur. And over 15 years, we've been creating content to help seniors get the retirement benefits they deserve. We started with Social Security, Medicare, Medicaid, and food stamp websites. And now we've added video content. I am also an adjunct professor. I teach entrepreneurial finance at one of the most prestigious universities in the country. If you're new here, hit the like button, hit the subscribe button, because we do appreciate your support. And as always, I want to know where you're watching this broadcast from. So do me a favor and go into the comments and let me know your city and your state. But let's dive into the breaking news here. There's been 10 changes already to Social Security this year alone. A lot of seniors are not aware of how these changes are going to impact their benefits. So my goal is to bring you this in detail so that you can understand the changes that are happening and how they are going to affect your benefits. So let's get started. The first is a $10,000 fine for what they are calling the Are You Alive project. This started this year, and its civil penalties for fraud have increased to $10,000 per offense, aimed to deter scams and protect the Social Security Trust Fund. However, some advocates worry this could cause many seniors to hesitate to file legitimate claims if they need paperwork or they need services from the Social Security Administration. So advocates are worried that this $10,000 fine that has been instituted for fraud is going to prevent seniors from going ahead and making legitimate claims to the Social Security Administration. So what is this project? Well, the Social Security Administration now requires seniors over the age of 90 to complete periodic check-ins to confirm they are alive and eligible for benefits. This is brand new. That started with the DOGE efforts this year. This is aimed to reduce erroneous death listings by 85%. That is what DOGE is claiming, that if you're 90 years old or over and you're still collecting Social Security, they don't believe you. They want you to come in and confirm that you're still alive and you are still in need of that benefit. Artificial intelligence now flags suspicious activities requiring in-person verification for about 15% of online applicants. That's people that are now applying for Social Security or auxiliary benefits. This helps prevent identity theft and unauthorized payments. And then there's been mixed reactions to all of this. While many support stronger fraud protection, some seniors and advocates warn that increased scrutiny could delay or complicate access for the most vulnerable. The second change that has happened this year is the overpayment withholding. If you receive a Social Security overpayment letter after March the 27th, 2025, the Social Security Administration will withhold your entire monthly benefit until the debt is repaid. This means you could receive no Social Security or disability payment until your overpayment has been recovered. This is a change from the previous policy. For the past year, only 10% was withheld if you were in an overpayment situation, but the Trump administration has switched it back to the previous policy. So the return to 100% withholding is intended to speed up recovery and save $7 billion over the next decade. For SSI recipients, you're still going to be at the 10%. So this new policy does not affect supplemental security income recipients who will still have to pay 10% if you are in an overpayment situation after March the 27th. But you have rights. If you get a letter from the Social Security Administration that you have an overpayment issue, you can appeal. If you cannot afford the full withholding or believe that the overpayment was not your fault, you have the right to appeal or request a waiver. A waiver essentially means you're telling the Social Security Administration you cannot pay the debt because it's going to cause you tremendous financial suffering. The SSA will not collect repayment while your appeal or waiver is pending. And you can contact Social Security Administration to negotiate a lower payment if necessary. The next change is that work credit threshold has increased to $1,730. What does this mean? To earn a Social Security work credit in 2025, you must make $1,730 a quarter. This means workers need at least $6,920 in annual earnings in order to qualify for the 4 credits that make up a year in terms of Social Security benefits. About 25% of freelancers and gig workers risk missing out on eligibility due to irregular income. This trend threatens retirement security for a growing segment of the workforce. Workers who do not accumulate 40 credits may have to rely on means-tested SSI benefits, which provides lower benefits and strict eligibility. This could push more seniors into poverty. Policymakers are considering proposals to lower the credit threshold or count caregiving years towards eligibility to modernize the system, because a lot of people provide caregiving to family members without getting paid. So the proposal is to count this towards their credit towards Social Security eligibility. The next big change that happened is Medicare Part B premium went up by 5.4%. Why should you care? Is because Social Security COLA went up by 2.5%. So a lot of seniors complain that the Social Security COLA that they get is eaten up by the Medicare premium, because Medicare premium is always rising faster than Social Security COLA. Medicare Part B premiums will rise 5.4% to $176 per month in 2025, eating up about 40% of the average COLA increase. This higher cost reduces the net benefit of Social Security raise for many seniors. Also, seniors earning over $103,000 will pay up to $594 per month for Medicare Part B premium, affecting about 8% of beneficiaries. This surcharge can significantly impact retirement benefits. But there's some good news. The Inflation Reduction Act, $35 insulin cap and $2,000 annual drug cap will help offset some of the increased costs. These measures aim to keep out-of-pocket expenses manageable for seniors that are on Medicare. Lawmakers and advocacy groups are pushing for further Medicare premium reform to prevent future COLA increases from being offsetting or eating up all your cost of living adjustment that you get from Social Security. The next change is that the full retirement age is going up again by 2 months. For those born in 1959 and later, the full retirement age increases to 66 years and 10 months. And then next year, for those born in 1960 plus, the full retirement age is going to move permanently to 67. So claiming benefit at age 62 now will result in about a 30% reduction compared to 26.7 cut for previous cohorts. So now that the full retirement age is going up and creeping up, if you collect benefits early at age 62, you're getting less and less of the benefits that you are eligible for. And as you can see, it's a permanent almost 30% reduction if you get benefits at age 62. And raising the full retirement age from 67 by 2026 is projected to extend the solvency of the Social Security Trust Fund by 3 years. There's been call to increase it even further to age 69 to extend the lifespan of the Social Security Trust Fund even further. Delaying benefits until age 70 increases monthly payment by 8% a year, with the maximum benefit, check this out, the maximum benefit for 2025 for Social Security, the highest amount you can ever get is $5,108. It means that you contributed the most for the 35 years that they count towards your benefit. Understanding these changes is crucial for maximizing lifetime benefits and making informed retirement decisions. There's also higher income earning limits for those who are working, collecting Social Security, and are under their full retirement age. So essentially, it's work more, keep more. In 2025, seniors under full retirement age can earn up to $23,400 before their Social Security benefits are reduced. That is up from $22,320 last year. This allows more seniors to supplement their income without penalty. For those reaching full retirement age in 2025, the earnings limit is $62,160. And if you go over that by $3, you lose $1 of your benefit. And then after full retirement age, there is no earnings cap. You can work as much as you want and not get penalized. Now, raising the earnings limit is expected to help 450,000 working seniors keep more of their Social Security benefits because then they have more room to make money without impacting their Social Security benefits. And then, as I mentioned at the beginning of this video, 3 million seniors are going to get over $6,000 payment due to the WEP GPO repeal, which was under the Social Security Fairness Act. The Social Security Administration has started issuing one-time payments averaging $6,000 to over 3 million retirees affected by the windfall elimination provision and the government pension offset. These payments retroactively cover adjustment back to January 2025. So this is only affecting 3 million people, about 3% of Social Security recipients. And so the question has always been, why is this not extended to everybody that's collecting Social Security? Because a lot of seniors are struggling. And if the Congress is going to increase Social Security benefit for a certain group of people, why are they not doing it for everybody? That is a question that I want to hear your thoughts about, because the Social Security Fairness Act was to solve a specific problem that affected a specific group of people. But a lot of you are saying it should have been done for everybody. In addition to the lump sum, these retirees will see their monthly Social Security checks increase by around $150 a month, addressing a long-standing complaint about unfair benefits reduction. This increase aims to provide greater financial security to those with mixed public and private sector careers who were denied Social Security benefits or were given reduced benefits because they were getting a public pension. For years, the WEP and the GPO reduced or eliminated Social Security benefits for those who also receive pensions from the government. This action corrects this issue by providing fair compensation and improved monthly income for this population. And the implementation has already started. And so come, April 2025, this is where we are right now. You are going to be receiving a $6,000 check, or it may already be in your account. And if you see it, it is real. It is part of the Social Security Fairness Act repayment or back pay amount. And then there's some good news on Medicare drugs. Now states are giving some flexibility. Florida has received FDA approval to import prescription drugs from Canada, where prices are about 50% lower. This could save seniors hundreds or even thousands of dollars each year. Remember, the average senior spends $300,000 in their lifetime. The average senior couple spends about $300,000 on Medicare. So this is going to be a big deal. 12 other states are pursuing similar drug importation programs, aiming to cut out-of-pocket costs for chronic conditions. If successful, this could become a national model for reducing prescription drug expenses, especially for seniors. The FDA is expediting approval for generics and biosimilars, increasing competition and lowering prices. This is expected to make more affordable drugs available even sooner. But however, as expected, the drug companies are not happy. Drug manufacturers are fighting these changes in court, citing safety and supply concerns. The outcome will affect how quickly seniors are going to see these savings. Another change that is happening this year is higher earnings limit for working seniors. I've already talked about that. So let's move on to COLA. This is a hot topic. So I've given you a chart of COLA changes from 2010 all the way to 2024. As you can see, the average COLA is about 2%. So this year it was 2.5%. But the big issue is that inflation is still high. Prices have gone up and stayed up. So a lot of seniors are unhappy about the $40 increase they're getting this year per month as Social Security increase, because that doesn't even buy groceries for a week. So Social Security beneficiaries will see a 2.5% cost of living adjustment in 2025, raising the average monthly check by $49 to $1,976. SSI recipients will also see a slight increase, with the maximum benefits going to $943. But here's the thing, inflation still is higher than COLA. Despite COLA, many seniors face $1,400 annual shortfall. That's a deficit that the average senior is going to face as healthcare and housing costs continue to outpace benefit increases. This means the raise may not fully keep up with the real world expenses. And then higher benefits could push some retirees into taxable brackets, reducing their net gain. Seniors should review their tax situation with a professional to avoid surprises. And then, as I mentioned, the SSA is changing a lot of things by what you can do over the phone. They've reversed some of those policies, but a lot of them are still going to be in place. So let's talk about it. After public outcry, the Social Security Administration reversed plans to eliminate phone applications for retirement and survivor benefits. This is a major win for 40% of seniors who lack reliable internet or struggle with digital systems. Without phone services, nearly 4 million additional office visits would have been required annually, overwhelming Social Security offices. Phone services are essentially vital for rural residents and those with mobility challenges who face long travel distances to nearest Social Security offices. The SSA will continue using real-time verification during phone calls to combat direct deposit scams and identity theft. So if you're going to make direct deposit changes, you cannot do it over the phone anymore. You have to go online and verify yourself online. And if you cannot do that, you have to go in person. This is going to create a lot of inconvenience because a lot of seniors change their direct deposit information over the phone versus having to go into the office or do it online. And then there's the huge, long-awaited executive order from President Trump about immigration fraud and illegal aliens that are on Social Security. President Trump, in April 2025, approved an executive order stripping Social Security benefit from over 6,300 undocumented immigrants and eligible recipients. This is a move that is intended to save the Social Security Trust Fund about $200 million annually, redirecting funds to eligible seniors. So basically, by reducing fraud and waste and abuse, the idea is that the president wants to return more money into the system so that those that are currently on benefits can get more money. I don't think it works that way, but that's the intention. The SSA now requires enhanced in-person proofing and advanced fraud detection technology for suspicious claim. These changes are designed to prevent identity theft and fraudulent claims, which account for $33.5 million in misdirected payments from 2013 to 2018. The order also reinstates civil penalties of up to $10,000 for filing a false claim, a measure that has not been used in years, but the Trump administration is bringing it back. It is expected to deter fraud, but may also cause anxiety among seniors who have to navigate complex paperwork to get their benefits. And then there is fraud prosecution being expanded to 50 U.S. attorney offices, especially in regions with high undocumented populations. And the SSA Inspector General will also intensify oversight of eligibility and payment integrity. So all these changes are happening this year, and I don't know if you are aware of it. So let me know which one you think is going to impact you the most. Which one are you excited about? And which one are you frustrated by? I want to hear from you in the comments below. Now let's talk about Medicare for a second. Advocacy for Medicare. So there's a lot of news happening about Medicare, and it's probably challenging to keep up with all the changes, all the limitations, all the restrictions, and the plan additions and subtractions that are happening in each state. Some states have taken the matters into their own hands, trying to fix Medicare, but have been unsuccessful, like California. And you get news like this from Oregon, where 25% of plans are planning to leave. In Minnesota, where people have to choose between sticking with a doctor or a health plan. All this is because there are 24,000 plans out there that you have to deal with. And you have to figure out which plan is right for you. If you're turning 65 or you're already on Medicare but want to find the best plan for you, you have to consider plans that are in your local area, plans that fit your budget, the coverage you need. And then each plan has their own options, their restrictions, costs, and co-pays and deductibles. And all of that can be overwhelming, which is why survey has shown that 90% of all seniors are in the wrong Medicare plan. This could affect your pocket. It will cost $300,000 a year for a couple to really get the right Medicare that they need. And it could affect your health, because if you are in a situation where you need particular health services, but your plan does not cover it, or your doctor is not even in the network, that could create challenges for you. So my question to you is, who is advocating on your behalf when it comes to Medicare? That is what we are here to help with. We've partnered with Chapter Medicare, and these guys, the biggest thing is that they are advocates for you. It's a free service. Their whole mission is to make Medicare simple, help you understand your plans that are available to you, choose the best plan, and then use your plan. So this is coming from one of the co-founders who had a personal experience with Medicare, watching his parents struggle to navigate the process of choosing a Medicare plan, winding up paying premiums that were hundreds of dollars per month, more than they ought to have paid. And he realized that this was a very terrible experience navigating Medicare signups and changes, and they got to be a better way. And so that is what they are in the mission to do here. This is one of the co-founders. He wrote one of the leading books on Medicare. And again, he's emphasizing the same thing. In his experience, he discovered that many seniors are getting misled into buying the wrong plan simply because they do not know, or people are not sitting them down and explaining what is available in their local area and helping them understand their options. So here's why we're partnering with ChapterOne, is that they have access to all the plans. The 24,000 plans I talked about, Chapter is the only organization that has access to all of them. Their services is free and unbiased, and they do not incentivize their agents to push specific plans. Their goal is to advocate for you and not the insurance companies. They want to work with you one-on-one to find the plans that aligns with your budget, the needs that you have, and the services that you need for your health. And then they can save you $1,100 a year. So their information is on the screen. You can call them today, 539-205-2147. Go to the website, askchapter.org/insider. Fill out a quick form. They'll reach out to you and help you. But you have to act now. There may be a short window for you to be able to switch to a better plan. Or if you are turning 65 and you have that 7-month window to sign up for Medicare, these guys will advocate for you, put in front of you everything that is in your local area that you're eligible for, and help you compare it to traditional Medicare. These are the people you're going to be talking to when you call them. This is directly from their website. These are some of their agents that are waiting to take your call. And as I mentioned, they are going to show you everything, including detailed information about your doctors, specialists, prescription drugs, hospitals that are covered, co-pays, and then you can compare that to traditional Medicare and make an informed choice. So call Chapter today. They can save you money and avoid being part of the 90% of seniors that are in the wrong Medicare plan. Or you can go into the description in this video and fill out the form and they'll reach out to you. They're highly rated by the Better Business Bureau, A+, lots of 5-star reviews online. These guys are the real deal. And then lastly, if you are overwhelmed by all the changes that are happening with Social Security in the news, Medicare, Medicaid, food stamps, more executive orders every single day about things that can impact your benefits, sign up for our newsletter. Go to our YouTube page. At the top of the page, there's a link to our newsletter. You can sign up and get real updates on things in and out of Congress that could affect your benefits. So sign up today, and you will find a lot of value in it. So that is all I have for you today. Until I see you tomorrow, thank you for watching this video.